Polycystic ovary syndrome is a very common condition in women, especially in the reproductive age. So it can cause significant health issues like in your menstrual cycle, in fertility issue, cardiovascular disease also can increase the risk of having that, and metabolic syndrome and obstructive sleep apnea, as well as mental health problems. More women now they do their own research. I notice also with my patients. So they're being more aware of the condition. That's why we're now being diagnosed, patients, a lot of patients now are being diagnosed with polycystic ovary syndrome. We have a theory called two-hit theory. So the first hit is the genetic predisposition of a patient to get PCOS. So it can be heritable, mga namamanang sakit, or patients who have family history of diabetes, like that. And what else? Second hit also, that means environment. So exposure, lifestyle, and what else? If a patient is overweight or obese. So those two, if you combine, a patient is really at risk to get polycystic ovary syndrome. Women with PCOS, they have difficulty in losing weight, or they easily gain weight. It's because of the hormonal imbalance that is present. So there is increase in the insulin levels in the body, and also increase in the androgen levels in the body, which then nangyayari, it increases the fat disposition. So here, fat disposition in the abdomen especially. We would see patients with PCOS who have what you call hyperandrogenism or excess androgen levels in the body. We would appreciate patients with acne, okay, and also excess facial hair growth or hair wherein some male parts lang nagkakaroon. So for example, here at the back, and then thighs also, and also here sa tummy, sa lower abdomen. So yun, so those are the patients who we can consider have polycystic ovary syndrome, and of course obesity or overweight. So with these patients, talaga we need to really to investigate further. So when we do ultrasound also, makikita namin they have polycystic ovaries. Okay, so maraming follicles yung ovaries nila. So those are the findings that we can see in patients with polycystic ovary syndrome. My short term and my long term. So with the short term, so those are the irregular menses, the acne, full-blown acne, and the weight gain also. For the long-term effect, this can lead to yung diabetes mellitus, metabolic syndrome, infertility, and to some, pwede magkaroon ng endometrial cancer. So we have 3 criteria. So dapat sa 3 na yon, at least in adults, 2 out of the 3 criteria, they should satisfy that. So number 1 is the irregular menstruation. That means you menstruate after 2 to 4 months. And second is presence of excess androgen levels in the body. So it can be through physical. So yun nga, the acne, yung excess hair, facial hair, and what else? Obesity. But sometimes, take note, sometimes lean patients also can be affected by PCOS. Okay, so not all the time obesity. And what else? Third is findings of polycystic ovary morphology via the ultrasound. Especially if they have prolonged the cycle is prolonged, they have to go to the doctor already. And for dysmenorrhea that can affect their quality of life, yes, they can consult with their OB-GYNs already. Some women with PCOS, they have difficulty conceiving due to the anovulatory cycle. So meaning hindi nag-ovulate properly yung patient na may PCOS. So because of that, walang ovulation mangyari, walang egg na pwedeng ma-fertilize. Number one treatment for PCOS is really lifestyle modification. Weight loss of around 5 to 10%, proper diet, low glycemic index, and low carbs, low sugar, and proper exercise. Aerobic exercise of around 150 minutes of moderate intensity every week with strength exercise. And second, we treat patients kasi through their symptoms. Okay, we treat them kung anong complaints ng patient. So for example, also, if the patient is bothered with her menses, we can regulate her cycle by giving pills. So we can give combined oral contraceptive pills. And if the patient also is concerned with her acne and hair, we can give anti-androgens. Okay, so for the hair, we can advise also patients to do waxing, what else? Shaving and laser. So after 6 months, kung walang nangyari doon, that's when we give mga oral anti-androgens na. We need to be sensitive to the patients who have PCOS. Because yes, like what you said, some patients, they really try their best to lose weight and then they diet, pero sila, very frustrated sila. But they don't know kasi na they have PCOS na rin pala. So, we really have to be sensitive around them kasi mentally, na-affect din sila. There are studies talaga that it can affect them with anxiety, depression, and sometimes yung body image nila. They get sad about it talaga. We can advise patients to seek consultation with their OB-GYNs to learn more about it, even though I'm sure they do their research. But it's better to be seen by an OB-GYN to explain more about their condition. So if you feel or experience any of the symptoms that I've mentioned earlier, it's best for you to consult with your OB-GYNs here in Makati Medical Center, where we can help you understand your condition and we can properly address your concerns.